She was a little taller than her friends and perhaps a bit quirky.
Frank DeFranco. But some people pronounce it Julia Fulmer, but I don't understand that.
But Julia Fulmer thought of herself as a normal 13-year-old girl until she found a lump on the back of her head while hanging out at a friend's house. Her blood work looked normal, but a CT scan showed reason for concern, so doctors biopsied the growth.
And then I get in there and they're like, "You have cancer!" And I'm like, "I knew it, yes, I called it." And so, don't get me wrong, it was a sad time, but it was like one of those, is this really happening kind of moments? And up until like maybe a few months ago, I still was like having trouble thinking about, because it was just constantly moving and stuff through treatment. You don't really have time to process that you actually have cancer.
The diagnosis? T-cell acute lymphoblastic leukemia. For 2 years, she pushed through chemo. She dealt with the nausea. She dealt with wearing masks and going to the hospital for every small fever, ache, or pain. She dealt with giving up playing soccer. And after 2 years, she's cancer-free. But it came at an unexpected price. The steroids she took with the chemo caused severe avascular necrosis. Her bones degraded to the point she had to leave her home in South Carolina and come to Mayo Clinic in Rochester, Minnesota for not 1, but 2 hip replacements.
Before the first surgery, I wasn't able to like move my legs apart like at all, hardly. And it was really, really hard for long distances and just pain and pain and pain, and I was just done with it, want to get it over with. So we came here to get the hip replacement because the bone was, at this point, very, very much so degraded, and we just wanted to stop the pain there.
Her first hip replacement was in March.
I just had hip surgery, and it's actually working out pretty well.
The second came in late July. Between 2 years of cancer treatment and now 2 hip replacements, it's been tough at times for Julia not to lose hope and not to feel like she lost part of her childhood. But she says she's found ways to stay positive through it all. She's an aspiring filmmaker.
6, 8, 9.
She's also gotten a boost from organizations like Star Treatments.
And I remember how cool it made me feel the first time we got on like a tour bus or got to show up to places, in a fancy ride. And just thinking back at, being that age, like how excited that would make me.
Matt DeRito travels the country in a tour bus as the bass player for a rock and roll band called Pop Evil. He started Star Treatments as a way to get sick kids to and from important appointments in style, hoping that the excitement of a limo ride would overshadow the pain or fear of the treatment.
She can either be in a limo or a party bus with her family and have her legs stretched out and not have to worry about really straining that hip back and forth to the airport.
For Julia, DeRito took it a step further and made sure her 6-foot frame could fly to Minnesota for her surgeries comfortably in first class.
When we rode on the commuter jets, I didn't think that it would be that bad, but when you're 9 days, 8 days after surgery and it's pressing up against the hip, it's gonna hurt. And so, at first, when we went there, I was like, hey, this is kind of nice, I could get used to this. And then on the way home, I was like, oh my goodness, this actually helps so much. This isn't just for glamour, this is amazing.
And while a comfortable first-class ride may not seem like much after cancer and 2 major surgeries, Julia's hip surgeon, Mayo Clinic's Dr. Daniel Barry, says things like that can have a huge impact on outcomes.
Because one of the things that I tell patients when they come in and are doing really well after surgery, they oftentimes say thanks, and I say, I'll take a little bit of the credit, but I also tell them that I think the most important factor for how patients do after surgery has to do with their outlook on life and their attitude. If people go into it with a positive attitude, if they feel like they're going to be able to overcome the obstacles that surgery always throws at them, pain, challenges getting going again, most of the time, if the operation's a good operation, they don't have problems related to the surgery itself, they're going to do really, really well. And I think it's the single biggest factor that determines the outcome of surgery.
Dr. Barry says staying positive likely played a big role in getting Julia through her cancer treatment and her surgeries. He says it's why Mayo Clinic tries to look beyond just the surgery or just the cancer and treat the whole patient. Julia says the whole picture approach has definitely made things easier for her to focus on getting better rather than on her pain.
And all the pain is a lot better because we are trying a different medicine and it's working really well, and now I can walk.
But it's just, everything here is so orchestrated to make the best experience, and everything moves so efficiently and quickly, and it's whoa, why aren't they doing this everywhere else? It's been great.
After 3 years that have been tough enough to break anyone, Julia says her religious faith, a better hospital experience at Mayo, focusing on her hobby of filmmaking, and organizations like Star Treatments making life a little easier have allowed her to get through it all with a smile on her face.
You just kind of make the best out of every situation, regardless of if it's a happy time or not.
For the Mayo Clinic News Network, I'm Ian Roth.